This is the New Hampshire Senior Vaccine Coalition presentation. The purpose of this intervention is to provide seniors with vaccinations. We will be focusing on seniors that would otherwise not get vaccinated, like elders of a low socioeconomic status, or those in hard-to-reach locations, those that are homebound, or those that are resistant to traditional medical care. Seniors with reduced mobility face additional barriers, so this program aims to eliminate those barriers. There are many behavioral factors that influence the likelihood of contracting the flu. They include smoking status, history of past flus, vitamin supplementation, physical activity, and lifestyle choices. The use of face masks, hand washing, and other precautionary actions can also help prevent the flu. This program is working for seniors because they are at heightened risk for catching the flu and dying from it. The CDC estimates that between 70 and 80% of flu-related deaths are in people over the age of 65. The best defense against the flu is the flu vaccine. New Hampshire's flu vaccination rate has dropped from 52.1% to 50.4% in the past 3 years. This program is essential for protecting a vulnerable portion of our population. Project Viva is a multi-level community-based intervention to increase influenza vaccination rates among hard-to-reach populations in New York City. This group delivered vaccinations to hard-to-reach populations in poor urban neighborhoods. Vaccinations were administered to seniors, drug addicts, sex workers, migrants, and the immobile. The volunteers provided door-to-door flu education and vaccines. Local seminars were held in common areas to increase public awareness of the flu. The program spurred great interest in being vaccinated. The priority groups, meaning those most susceptible, had the highest rate of interest. The door-to-door educational presentations increased interest in vaccinations up to 92%. Before the educational portion, 72% of people that never had received the flu vaccine expressed interest in getting vaccinated. After the educational seminar, almost 92% of people showed interest in being vaccinated. This program is based on the health belief model. It is a value expectancy model that is based on the balance of perceived threat and expected net benefit. This is a good model for the program because the actual threat of the flu to seniors is high. With a little education, people can learn about the severity and susceptibility they face. With door-to-door services and free vaccines, there is little cost and little reason to pass on the vaccine. The proposed intervention starts by identifying rural New Hampshire seniors in need of vaccinations. By partnering with in-home senior services like Meals on Wheels and Community Action Program, seniors that may be in need could be identified. Eligible seniors will also be found in low-income housing and from referrals. With community participation, word of this program could be disseminated all around. Homebound seniors can be referred by concerned neighbors, family, or other townsfolk. A community member and a medical professional will visit each location together. The community member is needed to establish trust and relate to local cultural norms. The team will deliver an educational presentation that describes the risk of the flu and the potential threat to society. The goal of this presentation is to show the danger of the flu and the benefits of being vaccinated. Statistics will be used to prove the efficacy of the flu vaccine. The medical professional will be able to dispel any false beliefs that the participant may have about vaccines. If the individual expresses interest, a vaccine will be administered at the medical professional's discretion. Personal information will be collected while the team waits to observe any potential side effects. Personal information will be used for follow-up phone calls to ensure the safety of the participant. Personal information will also be used to set up future visits and for program records. The program's effectiveness will be evaluated using a few different methods. The ratio of individuals that accepted or denied the vaccines will be the first method. The total number of immunized individuals and the number of those that would have not received a vaccine otherwise will be recorded. The state average for influenza immunization is 50.4%. If the rate within selected regions increases within the senior community, the program will be a success. Flu-related death rates will be collected from state and from local hospitals, so it will be compared to past years. Thank you very much for watching.